action.
Hi everybody, it's Martha Kennedy and I'm coming to you from Nexion. I'm a clinical nurse specialist and I want to talk to you today about our skin system. What do we know about skins? We know that when someone comes into the home or is in our home, that we need to make sure that their skin integrity is maintained the best we can. Let's talk about how we do that. Number one, we're going to identify those people who are at risk. And we're going to come up with some prevention strategies to make those risks lower. How often are we going to do this? We're going to do it on admission. We're going to do it on readmission. We're going to do it weekly. Weekly, yes, weekly, don't forget weekly. And change of condition. If I go from sitting up or walking around to being in bed, that's a change of condition. Check my skin more frequently. Okay. We've done that. Now let's say we have somebody that has a pressure area or a wound. We're going to document, right? First thing, document. How are we going to document? I'm going to go in there and I'm going to go and look at this wound and I'm going to measure it. Now, if you've never measured a wound before, it may be oblong, may be irregular, so I want you to make sure you measure up and down, towards the head. Always remember that, towards the head, and side to side. We also want to measure depth, okay? We want to see if there's depth, and we want to see if there's any tunneling. Then we want to talk about, what does this wound look like? So if I'm reading it, I can visualize what's going on. I want to tell the location, right? I don't know what to do if you don't tell me it's on the arm, the leg, or whatnot. I want to say if there's any drainage, and what does the wound look like? What does the wound bed look like? What is the color around? That's called peri-wound. So around there, that's important. Is there any warmth to the area? Is it cold? And is there any signs and symptoms of infection? We all know what a sign and symptom of infection could be. Comes to mind right away. Odor, right? Okay, so I found a wound, got it going. What do I need to do next? Let's take some action. First thing, I got to notify the doctor. I got to notify the RP, and I got to notify the dietitian. Because we're all a team. I found this, let them help me. Then I'm going to get an order from the physician on the treatment. Don't forget, we're writing the treatment order. We wanted to say what I'm using, how I'm rinsing that wound, any medication I'm applying, and how often I'm applying it and addressing it. Don't forget the PRN orders, because we know sometimes a wound or a bandage can become soiled, and so we might need to change it more than what the doctor's ordered regularly. And I know you know this, I have to say it, don't forget to date the bandage. Date and initials. Now, the RD is going to make some recommendations. Those are going to be included in your order. They're going to look at protein, they're going to look at supplements and nutrition, because we need extra nutrition to heal wounds. Another thing that will go in your orders are going to be those pressure relief surfaces. Do I need an air mattress? If I'm in a wheelchair, do I need a cushion? What do I need? Do I need heel protectors? Any of those things are going to go into your order. Now, we've talked about describing the wound. We all know that there's different types of wound. There's different stages of wound. How do we identify those stages? We're going to have a description, if you're an LVN, written down like we talked about. And then we're going to have an RN or an ND who's familiar with it. They're going to do the staging. I will talk about staging in my next video. Pain. This is going to be important because a wound is painful. You want to make sure when you identify that wound that we have something for pain medication. And we want to make sure before we do the treatment, I have given that resident something for pain and they're ready for me to do the treatment. Trust me, it'll make much better progress and it will be so much easier if we do this both for you and the patient. Now, I've done this. I've got my treatment done. Action's been in place. How am I going to monitor this wound? I'm going to do a wound assessment weekly. You'll find that under your PCC tab. And I'm going to keep, when I do this, it's going to ask me to measure it. Remember how we talked about measuring? If you don't, rewind the video and you can remember how to do that. And I also want to keep my team involved. Who's my team? We talked about it. The MD, the RP, and the dietitian. You'll find those at the bottom of the form. Don't forget that part, because being part of a team means everybody knows what's going on. Now, we'll talk about staging in my next video. If you'd like to watch it, we'll see you then.
Very good. Oh,